most commonly used medications for the treatment of COPD are bronchodilators. And the three bronchodilator classes that have been shown to decrease the frequency of exacerbations are long-acting beta agonists, long-acting muscarinic antagonists, and inhaled corticosteroids. Generally speaking, patients with mild disease and infrequent exacerbations, you'll start them out on a single inhaled agent, typically a long-acting bronchodilator. In those with more moderate disease or who have frequent exacerbations, you'll then typically add a second agent. And in patients with severe disease, you'll usually consider adding a third agent, especially if they have frequent exacerbations.
Another option to prevent COPD exacerbations is Roflumilast, a phosphodiesterase 4 inhibitor. It has been shown to result in modest improvements in FEV1 and also decrease the likelihood of an exacerbation. However, it is not known if it provides additional benefits beyond inhaled therapy for COPDs, such as long-acting muscarinic antagonists or inhaled steroids. We know those drugs from many studies do prevent COPD exacerbations. Roflumilast has also possible adverse side effects of insomnia, nausea, headache, and diarrhea. I would consider it in patients who cannot take or fail azithromycin as another way to prevent COPD exacerbations.
One thing that people often forget about is vaccinations, and so the influenza and flu vaccines can help to prevent COPD exacerbations. Theophylline and chronic daily antibiotics or 3 times weekly antibiotics have in some studies shown to reduce the frequency of exacerbations. However, both of these therapies have a lot of side effects, and so generally the inhaled medications and the PDE4 inhibitors are preferred.
With respect to prophylactic antibiotics, studies have had mixed results, but in a systematic review of several studies, prophylactic antibiotics were found to have a significant reduction in the number of patients experiencing an exacerbation, but no improvement on hospitalizations or mortality or lung function. Specifically, with respect to the antibiotic azithromycin, one large study found that daily use of azithromycin compared with placebo led to an increase in the time to first exacerbation by 92 days and was also associated with an overall decrease in the rate of exacerbations. There is also some similar data showing a beneficial effect of moxifloxacin. For most patients with COPD, I do not suggest administering prophylactic antibiotics. I would consider antibiotic prophylaxis, though, in carefully selected patients, such as those who have had at least 2 exacerbations in the past year, in spite of optimal COPD therapy with inhaled agents. If a patient meets this criteria, I would recommend antibiotic prophylaxis with azithromycin.